So I'm going to talk about a concept called, we've been calling the Pathology Plan. And this is really our attempt to create a plan within pathology, for pathology, by pathology. And it's really timely because we, we're we're in really difficult times, as I'm sure we're all aware across healthcare in the UK, and it's important that pathology has an informed voice that's contributing to decision making around healthcare, and this is important because up till now we don't really see that coming from anywhere else to any great degree. The pathology plan is not a single document. It's a concept. It's a whole series of things that RC Path have been doing and will be doing going forward. But clearly there will be publications and various launches of particular parts of that. I'll come to that later. We know about the state of the NHS and you know I, you know these are all new. We've got huge waiting lists, and these aren't really getting significantly better because there's huge pressures, there's huge gridlock across the whole system, and big shortages in capacity and productivity. This is the sort of graph that's currently exists for waiting lists for hospital treatment, coming down slowly, but to be honest, no real evidence that that's because we're doing anything differently. Similarly, ED is important, and the waiting time in ED again remains incredibly difficult. This is a 4 hour graph. So there's a long way to go. Nothing's going to change dramatically overnight, but we really need to keep pushing as best we can and working with all agencies, including government and NHSE and other NHS in other parts of the UK. GP access, according to the public at least, remains very difficult. And I'm sure a lot of that is true. But as we move to new ways of working, we have to really try and increase the productivity there. Part of the problems GPs have, of course, is the lack of movement within secondary care limits their choices, and of course, patients have to wait. So public confidence in the NHS is at an all-time low. However, we need to remember that it's not all bad. The NHS carries on every day, over 1 million interactions. Patient lives being saved, patients being treated, and so on. And as pathologists and scientists, we are a huge part of that. We're also seeing, of course, expansion in the private sector, and that includes in pathology as well, where many of our histopathologists, of course, arguably the majority of them, are now working at least part-time in the private sector. And you can see why that's the case, given that the work can be controlled, the payment is higher. And in the advent of digital pathology, it's easier to do, and you can sit at home and do it. So that there are big concerns over the NHS. Government, of course, came in last year, and to be honest, while they get a bad press from the media and from the public at the moment, I think they came in with good intentions to really try and sort a lot of things out that had been ignored for over a decade. But of course, they've been hugely fiscally handicapped. We can debate whether there is a financial black hole, but I think those of us working in the NHS can absolutely see a huge black hole, and it limits us from doing the things that we want to do and should be doing. Um, Arguments and controversies again over taxation, borrowing, the backlash around that is it's all become very political, unfortunately. And the NHS is once again a sort of ball that's chucked around politically, and that really limits common sense decision making. Lots of things, of course, that are blamed on the financial position, and the workforce position as well, listed there. And it's pretty much that we've seen a huge impact from all of those. I guess the point that we're at just now, and politicians are now, questioning why, given the increased number of staff in the NHS since, before the pandemic, and the increased, amount of money that's gone into the NHS, why is it that we've seen productivity fall? And of course, we all know that there are good reasons for that. You know, a reduction in productivity can be put down to a lot of things. The withdrawal of goodwill being a starting point, but also the fact that younger people coming in to the workforce are maybe not as willing to put in the extra hours and want to work more part-time, and that's a generational effect, and we need to account for that. I think it's unfortunate now that politically we've reached a stage where senior government ministers and leadership within the NHS, within NHSE, are now, openly stating the NHS is overfunded and overstaffed. And, for those of us working in the NHS, that's a real slap in the face. But nevertheless, you can see where they're coming from. And we need to counter that by demonstrating that our productivity hasn't fallen. And in many ways, if we are given the staff and given the funding, we can absolutely raise the bar in terms of productivity, efficiency, and output. There's been lots of plans, of course, which I'm sure you're all aware of. Before government came in with the long-term workforce plan from the Tories, and this really aimed at doubling medical student numbers, increasing the number of doctors, and all that kind of stuff. But I think it's been realised that feasibly that's not doable and it's not affordable. Someone commented that by the year 2050, we could be spending, if we carry, excuse me, if we carry on the same trajectory, we could be spending our entire GDP on healthcare, and that the entire population will either be in a bed or standing round the bed looking after the person in the bed. And so it's not feasible just to keep on going and increasing training and increasing the workforce and so on. We need to think differently. We need to do things differently. Darcy Review was the first thing the government did, which was really a rubber stamp to say, yeah, you're right, the NHS is in a complete mess and we need to do something about it. And then came of course, the 10-year health plan for England, and there's been similar plans, across the board. More on that later. And we're waiting on the National Cancer Plan, which I'm told is going to be, focusing on 10-day turnaround for histopath, for example, and possibly the same for genomics as well. So real tough targets that are going to be very difficult to deliver on. Um, Jeff, of course, has spoke, about the medical training review, and that this is really needed. I think Chris Whitty and Steve Powers have done a great job highlighting a lot of the main issues. There's a lot of good stuff in there, and of course, but we need change. We need change to happen quickly. But of course, as Jeff has alluded to, it's difficult to get that kind of change in a quick, route. And that's because of two things. One being it's complex and we can't do everything overnight. But secondly, change costs money and there isn't a lot of money about. So we need to be patient. We need to work with, the agencies and ensure, excuse me, that we get there. The long-term workforce plan is a key document as well. Excuse me. Sorry. And that's been kicked off into spring of next year, but it's hinted at the moment that it's likely to not look at massive expansion of the workforce. It's going to be more pointed towards making do with what we've got, working differently, and so on. And just to chuck in at the end, Carter Review 4, more on that later. The common thing about all of these plans and reviews, largely, is that they don't really mention pathology much. In fact, some of them don't mention pathology at all. Pathology wasn't even mentioned in the 10-year plan. Not surprising, though, to be fair, because these are quite high level plans. But again, we need to be sure that we're, making sure that our voices are being heard and we're not forgotten about. And as we see with the 10-year plan, pushing towards neighbourhood care, pushing towards NHS apps and so on. We need to be sure that we are definitely part of that. The three shifts, to community, to prevention, and also to a more digitized way of delivering healthcare. Again, we can absolutely align pathology to all of that, and we need to keep shouting loudly about what we can do to make that happen and what needs to happen in pathology to allow us to do that. So the neighbourhood health program, is pushing forwards, and we need to be part of that. Um, Single patient record NHS app is difficult for pathology because, as we know, pathology doesn't feed into it other than through GP practice screen grabs, which is an appalling way to do it. So there's a huge patient safety issue there, and we need to get our standardization right, our interoperability right, and ensure that we can directly put our patient-friendly pathology outputs and reports that patients can read and understand. Of course, the difficulty is there's no more money. At best, we're going to see 3% per year added to the NHS budget, and that will barely cover salary increases. So we need to work differently. But as has been pointed out, it's not that there's 3% up for grabs, it's the fact that there's 103% sitting there, and we need to look to see if we can modify the way in which money is spent to bring more money to pathology, to save money elsewhere, and improve patient outcomes. Workforce and the 10-year workforce plan, which we await, and we're obviously putting in comments to that consultation, which is ongoing and I think finishes today. And we need to also look, at how the future training review goes forwards. But the bottom line, which I think we need to be wary of, there's no more money and no more staff. Let me come back to that in a minute. Carter review has begun. It's rapid. I'm part of the partner board, of which the first meeting is on Thursday, and we'll be attending that. Um, to be fair, the profession hasn't been good friends with previous Carter reviews. Carter reviews in the past, while promoting the formation of networks and so on, which many of us would argue has been a good thing. They nevertheless have focused on productivity, efficiency, a race to the bottom, and really complete disregard to quality, to patient safety, and various other aspects that we know are important, including the well-being of staff. So we are working really hard to ensure that it's not just about productivity and consolidation. It's about looking at patient care, looking at quality, and looking at the way in which pathology impacts the wider healthcare pathways, because these are just as important as the individual silo lab budget. We have, of course, been experiencing service failure, but there's not a word to put it that way. Pediatric perinatal with approaching 40% vacancy rate now for consultants, similarly for immunology, and real collapse of services in big centres like Birmingham, Bristol, the whole of Northern Ireland. And the numbers aren't looking good. When we've looked at workforce planning, because to be fair, no one else is really doing it, then the writing's on the wall. The trainees that we have will barely keep that 40% vacancy rate where it is. Worse in immunology, actually, where we've got a huge retirement cliff edge coming up for the existing immunologists, and that's real risk to allergy services and immunodeficiency services, which are the kind of services that are typically ignored because they're not seen as frontline and they're not seen as important. But as we move into new cancer therapies, it's going to be vitally important to acknowledge that, because a lot of the new cancer therapies are going to create a huge number of elderly immunodeficient patients that will need that kind of specialist input. So big challenges. Similarly, future challenges around workforce because of population trends. Demand is going to increase massively, 10.43 billion by the end of the century worldwide. And it's not just about the numbers, it's about the demographics. And in the UK, 2066, there's going to be this huge hump of people above the age of 70. And of course, elderly people bring more disease, more cancer, and need more pathology. So our workforce is under pressure, and it's going to become under pressure more going forward. It's not just about pathologists; it's about the whole family of the pathology workforce, and also those that support us outside in industry and in the tech development, and also the supply chain. So within the college, we've been developing our own workforce strategy, which is based around the train, retain, reform, but also adding in contingency. The train bit is difficult, really difficult. We appreciate the lack of money in the system. And then while our disciplines remain popular, we don't have enough training numbers that we would like. And we've actually seen a fall in the number of histopath training numbers because many trusts are now stepping back from willingness to pay for their 50% of the salary costs. And while there's more potential training numbers promised, 1,000 was mentioned in the 10-year plan, and 2,000 was mentioned in the political football that the Prime Minister and the Health Secretary are kicking around with resident doctors at the moment. No one really knows how that's going to work, but it's likely that the money for that will have to come from NHS trusts. So that gives us a big, big problem because NHS trusts are highly unlikely to want to spend money on non-front facing medical services such as pathology. So we've got a huge, huge barrier within that, and we need to work hard to lobby hard and point out and collaborate with NHSE, workforce and training, and so on, in order to get something out of it. Retention is going to be important, focusing on well-being, and again, lobbying for changes and things that will make retention easier. But to be honest, we haven't seen any of that happening yet. Reform is very applicable, and I could speak for hours on this, but we need to embrace automation, digital, new IT systems, new LIMS systems, new Order.com systems, and inevitably AI. AI is a buzzword which is working against us at the moment, unfortunately, because politicians largely believe that we don't need pathologists because AI will be doing all the work. The reality is not a chance. And not at least for 10, 20 years, because there just isn't the basic infrastructure there to support it. And also big question mark over whether it's safe and whether we can afford it. Very expensive. Contingency is going to inevitably be an important part. That's where we reduce the denominator, the demand, and ensure that we get things like demand optimization rolled out across all clinical services to ensure that appropriate testing is focused on. But inevitably, there'll be some hard choices because we won't be able to do everything. So big challenges for pathology. We're part of the NHS gridlock. There's a workforce crisis, no real plan for pathology that we've seen. And we've got a huge gap in tech and IT, which will allow us to reform our services and take account of that. There remains a big unwarranted variation in pathology tests, and we're beginning now to see service failure. Pediatric perinatal immunology today, histopath tomorrow. That's the way we see it. Limited increases in funding will make it difficult, but overall, putting all this together, despite these pressures, there is no pathology plan. So that's why we're focusing on it ourselves. Basic principles really are around pushing all of these areas, lobbying and advocacy. We've put great efforts to try and increase that, and only this week we've been in the House of Commons, demonstrating. Sorry, last week demonstrating, that pathology can bring solutions, and not just to 10-year plan, but to cancer care as well. Um, Increasing collaboration with other pathology societies and also with industry, so that our voice is stronger and more collaborative. And again, expanding our corporate engagement. We've only just over a year of doing this, and we've got many corporate partners now, and we're working together with them, not just on education, but on lobbying for pathology causes and creating roundtable white papers in the future. Workforce plan is out there. We're beginning to churn out using our census data now, good spotlight documents. There's 3 or 4 of them now on the go, and we aim to piecemeal cater for the other pathology disciplines in time. We're about to form a new digital strategy board because digital is going to be so important, and that'll be a new board that will have various committees sitting under it, looking at AI, not just in histopath, but in the other disciplines as well, where it's going to be just as important. Looking at informatics and looking at the way in which all of these impact genomics, hematology, and various other disciplines. And finally, membership engagement is important, and we need to ensure that the membership, engage and understand that this is important for them. It's important for their entire, professional well-being. The college is going to be the main output that is going to be singing for pathology and for them and for services. And it's not a them and us, we're all in it together. I hate to use that phrase. Right, pathology plan, in terms of a document, yeah, we're working on a document as well. Hopefully, we're going to get it tidied up and put out in various formats in the very near future. It needs to be concise, needs to be targeted. Again, different formats for different areas. And again, it needs to be timely. We want to get this out ideally before the end of the year, before the Carter report reports, for example. Um, and also, we need to split it up and look at ways in which we can, separate different themes on workforce, different themes on tech, and so on. And no doubt we'll have various events and promotions associated with that in the new year. Chances are no one will read it. No one will take any notice of it, like everything before. But you know, well, that would be disappointing. Everything we do still has an impact. And if anything we produce on paper or in report format, it acts as a reference point that we can then go back to and build on. We need to be positive in all of this. No, gone are the days where we just shroud wave and complain how bad things are. We need to be solution based. We need to be aligning with government plans. We need to be saying, here's what we can do in pathology for the 10-year plan for the three shifts. But in order to do that, we need X, Y, and Z. That's the way in which we've got to approach this. Just standing up and shouting, "Oh, pathology is terrible, it's failing, and we need more staff," is going to get us nowhere, especially given the fiscal barriers that are present within government at the moment. Okay, almost there. What's going to be in it? We're going to be looking at workforce. We've already done a lot of the stuff in there. We're going to be looking at, interoperability of data and so on, and introduction of new tech, because all of that is going to be important to kickstart, all of the stuff that we see pathology being so important for within the 10-year plan and other plans, for example. We need to look at workload and diagnostic stewardship more. We need to, persuade the rest of the healthcare community to really embrace this. And of course, the big push to neighbourhood as well. Where it's not just about the cost of it, it's about the value that we can provide. The cancer time bomb will continue to tick and expand, and we need to be wary that pathology plays a hugely significant role in that, not just in diagnosis, but in therapy choice, and increasingly we need to ensure that we have the capability and we have the capacity to deal with that. And last but not least, training. We need to ensure that we're training the right people for the right jobs of the future. You know, um, we need to ensure we're training them in the right place, and also ensure that our output is going to match what the likely capacity and demand that is required for the future is going to be. So again, we're aimed at sort of publishing something from this at the end of this year, early next year. But meanwhile, there's a lot of activity going on within the college, has been for the last year and a half or so, that is contributing to the voice and the output that we absolutely need at this time. So thank you for your time. And a final message is, get involved, support the college, because as I say, this is our college, this is our profession, and we really need to step up and shout loudly about why we're important and what needs to happen. Thank you.